so you've had your toes done. So as we've discussed in the hospital, it's really important the next few days, well really the next couple of weeks, you keep your foot up as much as possible. The foot is probably one of the hardest points of the body to heal. It's a long way away from the heart. So we like you to elevate your foot. So it's a bit like a river. The blood's going to flow back into the body, stay out of the toes, which is going to help it to heal a lot more quickly. So it's really important, elevate some more and elevate again. Okay? If it's down, it's going to swell up and then the wounds can get a bit mucky and then that can introduce infection into the area. So the main goal is by the time you go back and see your surgeon is that the wounds look really good and then you'll be able to start doing a little bit more. Now, in a lot of cases, you're only allowed to put a little bit of weight down through your heel, or you'll be in a little shoe, which will have given you in hospital that you can just walk down through, and that stops the toes from bending. Okay, but as I said, I don't want you out and about. It's really toilet privileges for that first couple of weeks. Now, it takes 6 weeks for the soft tissues in your foot to heal. It takes 3 months for the bones themselves to heal. And normally with feet, toes may be not so much of a problem, but it can take a long time because we're walking through it. So be really patient with it because they will get sore and they will get swollen if you push them too hard, particularly if you've had both feet done at once. So the takeaway from this is the first couple of weeks is to put your foot up as much as you can. Okay, elevate it up on the couch or in bed and really only go from the bed to the couch. We don't want you doing housework, we don't want you doing cooking, we don't want you out and about. When you go back and see your specialist, the dressings will come down, and if they're all looking good, then you're allowed to start doing a little bit more, but you really want to be careful with it for the first 6 weeks up to about the first 3 months. In terms of physio, the specialist will discuss with you if you do need to have any physio. Sometimes for the toes you don't need to have too much, it's more just getting back into walking. But if they do, then they'll recommend it when you go back and see them. Our numbers on the sheet, if you have any problems or you have any questions, give us a buzz. We don't want you doing any exercise or anything with it at this point in time, so there's really just that elevation we want you to do. Good luck with the rehab.